So cardiac CTA, that's basically a CT angiography of your heart. And what that means is it looks at the blood vessels of the heart, as well as the aorta, which is connected to the heart and is the large blood vessel connected to the heart. And it would look at for structural changes like blockages in the arteries or any genetic changes in the actual structure of the arteries or the aorta. And basically, you would have an IV during the test, and contrast would be injected through the IV into your heart arteries and aorta to take a look at, if there are structural changes or not. And it also includes a calcium score. And like we talked about before, calcium score tells us the amount of calcification of the arteries of the heart. Cholesterol blockages over time become calcified. And so the cardiac CTA would show you if there is cholesterol blockages, and then it would also count how much of the cholesterol blockages are calcified. And a calcium score would just show you if there's calcified cholesterol blockages, but it wouldn't tell you if there's any cholesterol blockages that are not calcified. Now, the reason people get calcium scores though instead of a cardiac CTA is calcium scores involve a lot less radiation than the cardiac CTA, and also there are some other specific things to the procedure. Cardiac CTA, your heart rate does have to be slower, so a lot of times you have to take a beta blocker before the test, and so on. Generally, you wouldn't have a cardiac CTA unless you have some indication, like a family history, that would be concerning, or some sort of symptoms, and you decided with your cardiologist this is the best test for you to get. Calcium score is a lot more common because it does involve less radiation, and generally you don't, need anything else. It's just a pretty straightforward test where you don't have to get contrast, you don't have to have your heart rate lowered, and so on.